Hey guys, so my presentation is on SIDS, which stands for Sudden Infant Death Syndrome, and this is also known as crib death because infants who die from this condition often do so under cribs. SIDS is the sudden, unexplainable death during the first year of life, so infants who are between 0 to 12 months old. It is a morbidity that doesn't have any sort of explanation to it, despite any autopsies made or any investigations made to figure out why the baby might have died. And it is also the #1 morbidity for children between 0 to 12 months old. Though there's no clear cause that has been identified yet, there are a number of risk factors that seem to correlate with getting SIDS. Risk factors that seem to increase the baby's risk of getting SIDS include gender. Boys are slightly more likely than girls to get SIDS, which kind of shows that there's some sort of genetic susceptibility at play, but the exact specifics are unknown yet. Age. Infants are more vulnerable to die from SIDS between the 2nd and 4th months of life. Season. For some reason, there has been more reported cases of infants dying from SIDS during the winter season. Babies who are not breastfed, and those who are born prematurely or of low birth weight. And there's also higher chances of this syndrome occurring in babies who are born from a mother who comes from a low socioeconomic factor, who drank during pregnancy or smoked during pregnancy, or who didn't get any prenatal care. The most well-known modifiable factors have to do with how an infant sleeps. So in this video, I'm going to focus more on how to reduce the risk of SIDS and other sleep-related causes of infant death. Side sleeping is not safe and is not advised. To reduce the risk of SIDS, infants should be placed for sleep in a supine position or on their back every time they go to sleep or take a nap, at least until the baby reaches 1 year of age. Once they can roll from supine to prone and from prone to supine by themselves, they can be allowed to remain in the sleep position that they assume. Many people think that infants sleeping on their backs have a higher chance of choking or aspirating, but that's not true because of the anatomy and the mechanism of the infant's airway protects them against aspiration, unless they have a certain type of upper airway disorder. Infants should be placed on a firm sleep surface to reduce the risk of SIDS and suffocation. A firm surface will not indent or conform to the shape of the baby's head when the baby is placed on the surface, whereas soft mattresses and those with memory foam could create a pocket or indentation and increase the risk of suffocation if the infant rolls on his or her belly. Avoid placing soft materials or objects in the crib, such as pillows, blankets, or toys. These items can obstruct an infant's nose and mouth and lead to suffocation. Safe alternatives to blankets are sleep sacks and wearable blankets. If mattress covers are used, they should be tightly fitting and thin. It is recommended that infants sleep in the parent's room, close to the parent's bed, but on a separate surface designed for infants, ideally for the first year of life. According to studies, doing so decreases the risk of SIDS by as much as 50%. This also prevents suffocation, strangulation, and entrapment that can happen if the baby is sleeping in the adult bed. Placing the crib close to the parent's bed allows the baby to be within view and reach and can facilitate feeding, comforting, and monitoring of the baby. Though it is unclear on why, studies have reported that pacifiers can reduce the risk of SIDS. The pacifier should be used when placing the infant for sleep, and it doesn't need to be reinserted once the baby is already asleep. Pacifiers should not be hung around the infant's neck or attached to the infant clothing to reduce the risk of strangulation. Research has shown an increased risk of SIDS with overheating. In general, babies should be dressed appropriately for the environment, with no more than one layer more than an adult would wear to be comfortable. Overbundling and covering the face and head should be avoided. Signs of overheating include sweating or the infant's chest feeling hot to the touch. The baby's There are many products for sale whose manufacturers claim to reduce the risk of SIDS. However, studies show that these items may not be safe. Some of the products that should be avoided because they're expensive and not approved by the FDA to reduce the risk of SIDS or even be safe for the baby include baby movement monitors, crib bumpers, wedges, crib tents, baby blanket sets, and infant positioners. Baby movement monitors have been shown to be ineffective and expensive. Crib bumpers line the inside of the crib and can pose a choking and suffocation hazard. With wedges, infants can fall off or turn over and suffocate against the cushion foam. Crib tents are proven to be ineffective and unnecessary. Baby blanket sets may look nice but can significantly increase the risk of SIDS due to suffocation and overheating. Lastly, babies can suffocate with infant positioners if they turn over on their sides. For the interactive activity, I have a short quiz that you guys can take as I read the questions out loud. And I'll give you guys a couple seconds to try to guess what the answer is before I reveal it. Some of the questions come from the video itself and others from the handout that I made, so taking a look at that beforehand will be helpful. A nurse is providing discharge teaching to a family who's taking a new infant home. The nurse reviews the principles of how to prevent sudden unexpected infant death at home. Which of the following principles should be included as part of this teaching? A. Always place the baby on his or her back or side to sleep. B. Keep the baby very warm while he or she is sleeping. C. Remove all fluffy or heavy bedding or pillows from the baby's bed. Or D. The baby should only be allowed to share a bed with a sibling, never a parent. The answer is C. Remove all fluffy or heavy bedding or pillows from the baby's bed. Sudden unexpected infant death, or SUID, is a form of accidental death that often occurs in the home in an infant under 1 year. Although SIDS is a form of SUID, an infant may also die unexpectedly when he or she is allowed to sleep in unsafe situations. Parents should be counseled to have their baby sleep by himself or herself in a crib without heavy blankets or quilts that could cause suffocation. The baby should not be overly warm while sleeping and should always sleep only on his or her back. Before a set of brand new parents are discharged, you want to educate them about SIDS prevention. Which statement by the parents needs more education? A. I cannot wait to take this little guy home and snuggle with him every night in bed. B. We got him a puppy to grow up with and he's going to have the cutest picture with him and they're gonna be best friends. C. We need to make sure the baby is sleeping on his back at night. Or D. I'm bummed that I have to take out all the stuffed animals from his crib. The answer is A. I cannot wait to take this little guy home and snuggle with him every night in bed. The American Association of Pediatrics states that parents should never let their babies sleep in the bed with them, stating the risk of suffocation, strangulation, and entrapment that can occur with bed sharing. You're about to discharge a couple who just had their first baby. Which statement by the parents needs more education? A. She needs to be placed on her back at night in the crib. B. I am so glad my husband quit smoking. C. Our baby's going to love her crib at night. Or D. I am glad that we got her a little stuffed bear for her crib and not a big one. The answer is D. I'm glad that we got her a little stuffed bear for her crib and not a big one. To reduce the risk of SIDS, it's important to teach the parents to avoid having any kinds of toys in the crib while the baby is sleeping. Which statement made by the parents needs more education? A. We won't buy any baby monitors because they are ineffective. B. There won't be anyone who smokes around our baby. C. Breastfeeding is important for the baby. Or D. We need to place pillows around our baby to keep him laying on his back at night. The answer is D. We need to place pillows around our baby to keep him laying on his back at night. Leaving pillows in the crib while the baby is sleeping can actually increase the risk of SIDS and suffocation. All of the following items should not be present in a baby's crib while he or she is sleeping, except A. A wedge. B. A pacifier. C. the baby's favorite toy, or D, a crib tent? The answer is B, a pacifier. Though it is unclear on why, studies have reported that pacifiers can reduce the risk of SIDS. Wedges, toys, and crib tents should be avoided. Babies should never be on their tummies, even when they're awake and being supervised. True or false? The answer is false. Placing babies on their stomachs with supervision is necessary to promote normal growth, since it helps them build strong necks and shoulders.